Hello, and welcome to the course on application of the OT process Older Adults 1, Behavioral and Physical Health. I'm your course coordinator and instructor, Dr. Danielle Mahoney. So you probably wonder who I am if I'm going to be teaching you for these 2 whole semesters in older adults. Again, my name is Dr. Danielle Mahoney. I'm currently an assistant professor at Columbia University in the programs of occupational therapy. I have been since 2022. I completed my OTD at Columbia University, focusing on the development of an assessment tool for self-awareness, specifically for people with acquired brain injury. I have been working in academia for almost 7 years now. Prior to this, I was at Iona University. And prior to working as a full-time instructor and professor, I was a full-time occupational therapist at Burke Rehabilitation Hospital for 7 to 8 years, I believe it was. I worked with patients with all different diagnoses who have had stroke, traumatic brain injury, spinal cord injury, cardio or pulmonary diagnoses, complex orthopedics, amputations. At Burke Rehab Hospital, it's an acute rehab hospital, inpatient acute rehab hospital. So the therapists there, we get to rotate every year to a different unit if we choose to, or if the administrators choose to rotate us. So I really got a really nice diverse experience there. In addition to the units on site on campus in the inpatient acute rehab, they also have partnering sites at subacute facilities. So I actually got to do another 1.5 year site rotation at United Hebrew in New Rochelle, which was a skilled nursing facility. You could see in the photos, I love attending therapeutic rec activities and adaptive sports events. You could see the bottom left photo. There is a picture of when I brought students to an adapted rock climbing experience. And then in the top right, that's an experience with hand cycling, which there's actually a lot of races and tournaments and things that I love to bring students with too. Those are actually some of my Iona students that went to that one. I have 3 sons, you could see in the photo, a 5-year-old, a 3-year-old, and a 1-year-old. One of my kids is a cancer survivor. You could see in the picture there, that is our trip to Disney World. That was his wish through Make-A-Wish that we went to recently, and so that was incredible. And I'm so excited to learn about all of you in the next few weeks, in the next few months. So please share with me as much as you are comfortable. Now we're going to go over some of the logistics about the course, which you'll also hear when you watch the video that I recorded about the syllabus and the schedule, but just some reminders. The course location, all synchronous sessions of this course will take place in LL 206, the OT lab, and our learning management system is Canvas. I use Canvas all the time for announcements, to send you emails, to post interesting videos as a bonus or extras. So please, please constantly check that site. So a reminder that the schedule and the syllabus are living and dynamic documents. This means that we must all be flexible and follow wherever this course might lead us. There is a lot of structure you could see I have in the schedule, so it won't be something like completely out of left field, but I do like to give us space to be flexible within our schedule and for everyone's learning needs. Again, this is why it is important to check Canvas often. I say every day, if not multiple times a day, when we are into this course and learning all of the content, because I might post things that you need to pay attention to quickly. We will be using kind of a flipped learning style in this course. It's not a true flipped learning approach, but it incorporates the ideals of it. A flipped learning approach is an approach in which first contact with new concepts moves from group learning space to the individual learning space in the form of structured activities, and the resulting group space is transformed into a dynamic, interactive learning environment where the educator guides students as they apply the concepts and engage creatively with the subject matter. So at the center of all of this is the student, and everything I'm trying to do is intentional to benefit all of your learning. The flexible environment that you could see there on the graphic. The flipped learning is based on allowing learners to learn in different ways and in different speeds, and to give learners choice in how they demonstrate evidence that they have mastered the course content. Flexibility also refers to the instructors in a flipped learning environment who are expected to be flexible in their plans, making on-the-fly adjustments for individual learners or for the entire class. If it's in the form of a formative assessment data that changes need to be made, we will do so. The learning culture. A flipped learning environment is a community that values the learning process in all of its forms, with learners at the center rather than the instructor. Students in a flipped learning environment are using their precious group space on high impact, meaningful activities that place their work at the center of attention. Meanwhile, the instructor provides scaffolding and feedback with a view not simply toward gathering numbers for a gradebook, but rather to help students learn. So you'll see we have so many great experiences for you planned throughout this course, whether it be practice with low vision simulators or the standardized patient project and program that we're implementing, or different worksheets or group conversations that we're going to have. It's all done very intentionally and to cultivate a group of learning. So the intentional content, like I was just saying, materials used in flipped learning are honed to a sharp edge with explicit connections to learning targets that are clearly stated. Text, video, and online content that is tightly constructed with high educational quality and very little fluff. And materials are differentiated so students of all different learning places in their curriculum can benefit and can work on something very meaningful. Some course policies and procedures. You hear it throughout this program, and now you're more than halfway through our program. You're pretty far along. Just remember to treat the classroom like the clinic. Come dressed professionally, come on time, be engaged, because that's what we would expect from you in a clinic. And your next couple steps in the next few months are to go into the clinic full time as a fieldwork student. We do expect you to attend all classes. I understand that life happens. So if you're unable to, communication is key. And please review the excused and unexcused absence policy in the syllabus and the student handbook. Again, life happens. Let me know as soon as possible so that if it impacts group work or a project or an experience that you're going to miss, we can plan as best we can. Like I said before, be on time, be engaged. That's what we want. I don't think that engaged only means being the first person to raise your hand. I truly mean that it can be so many different ways of being engaged, whether you're engaged in small group conversations, you're engaged in a Canvas board discussion group, you're engaged in projects and community events outside of the classroom. And just a reminder to refer back to the student handbook regarding policies for professional behavior, guidelines for participating in Zoom class, and excused absences, lateness, and exam policies. It is expected that all students will follow policies and procedures as outlined in the handbook. The schedule. So readings are due prior to the corresponding class. If it says experiential learning, dress comfortably. Let me just go back to one note about the readings before I forget. The readings are there to support your learning. If there is something that is not absolutely vital, it's not on the syllabus. So what's on the syllabus is what is applying to your learning for that session. If you would like supplemental learning materials, if you're saying, I'm just not getting this concept, or I want to learn more about this, I'm really interested in it, please let me know. I'm always happy to post more readings on Canvas for you. So like I said before, the syllabus is a living dynamic document that can be adjusted as needed based on optimizing the student's learning. And please watch and refer back to the syllabus video on Canvas for specific details about the course schedule. Just a reminder about your to-do list. This was supposed to be done prior to this course beginning, prior to you watching this video. But just a reminder, if they weren't done yet, or if you're having any problems with it, reach out to me as soon as possible. You should have already scheduled your fieldwork site visits for this August month, this summer. You should have already scheduled your interview and assessment with your older adult for the case study assignment. This is 2 separate visits with that older adult. And then to also schedule a consultation meeting with me via the Canvas calendar. It's only 20 minutes. This is a group meeting with you and your fieldwork partner, really to help you and to check in prior to you submitting your program proposal draft to make sure that you're on the right track so that you are set when you come back to class in the fall. I love this graphic. I don't think there's anything more accurate. The course expectations and reality, and then what actually happens. So again, life happens, and really, I can't wait to see where this cohort takes this content, because it's really different every year. Sometimes I get cohorts that are really interested in being engaged in the community and doing different events and learning that way. Other times I have students who thrive on very structured material and demonstrating their knowledge in a certain way in the classroom. So let your, voices be heard, give me feedback, and let me know how it's going as we go through this course. And we will do a midterm check-in to make sure we're all on the same page. And then housekeeping, your signed forms. Please read and sign the web-based education tools agreement and the honor code. These should be submitted on Canvas by end of day on July 31st. And then finally, this is a slide you'll be seeing very often throughout my lectures. This is describing what you'll have in those lectures. So this lecture was prepared following the CUOT anti-racist and inclusive teaching guidelines. Recognizing that this is an ongoing learning process, I welcome your feedback on how this lecture can be further enhanced through anti-racist and inclusive perspectives. So again, you'll see this. I'm going to be posting it at the beginning of most lectures as much as I can, just to remind us all, to keep us all accountable and to show that we're being really intentional with this course content. And I'm welcoming your feedback on how it is going. I have had students in the past who have brought up great points that I have incorporated into last year's cohort and this year's cohort. So please, I truly mean what this says is that I'm welcoming your feedback. On the first day of in-person class, we will make some community guidelines that has already been posted on Canvas and on a discussion board that I would love to hear what else you want me to include in there and what you need for you to feel welcomed and comfortable within this learning space. Thank you.